Hello everyone, this is Anirudh Agarwal, the organizing secretary for SAMSACON 2.0 or SAMSACON 2020 as you can say. And it's with immense pleasure that I have the opportunity to welcome all of you, all the SAMSACON delegates as well as the other medicos joined here today. Um, this is one of the pre-conference event for SAMSACON 2020 and in association with Marrow, of course. SAMSACON is the annual SAMSACON 2020 is our second edition of our annual medical conference, SAMSA, that is South Asian Medical Students Association. And today here we are present. Today here we are present with an interactive session with our with the help of our title sponsors Marrow. They'll help us out with an interactive session today on career guidance, which will be followed with a live question answer session from the chat box. And for that, for the same reason, we have today with us Mr. Naveen here. So I would like to hand it over to him to start the session without any further delay.
Okay.
Over to you, sir.
Thank you, Anirudh, and thanks for arranging this interactive session. I hope this is the first interactive session by any platform after this next NMC bill is passed. So all of you most of the students here must be waiting. What will he tell? What will be this bill? So, but for all of you guys, I'm not going to talk anything regarding NMC bill, but I'll give some clarity what you need to prepare, how you need to prepare. NMC bill was approved, but no official confirmation, no rules and regulations were set. It takes minimum for 6 more months to come up with the rules and regulation. A body was formed, and now 6 more months is there to form the rules and regulations. Right. The chat box, I'll present I'll take 20 minutes of your time, at least 10 to 15 minutes of your time, and then I'll go with the chat box for Q&A session. Okay. So by the way, I'm Naveen Sankar. Let me share my screen. Hope all of you can see my screen, right? I'm very sorry. Here it's raining very, very, very heavily. So my internet might be fluctuating. So don't, forgive me if there is an inconvenience. Right. Hope all of you can see my screen, right?
Yes, sir.
Right. Sorry, if you are making these small things, please don't put your fingers on the screen. That will make sure that there is no disturbance, right? Coming guys, welcome. My name is Naveen Sankar. I hope some of you know me, some of you don't know me. I take care of complete academic counseling. At the same time, I involve in onboarding different toppers. Right, I be with the toppers and I try to understand how do they study, what kind of preparation strategies they use, how do they manage both prof exams and PG entrance exam. With the help of these toppers, I try to come up with different strategies which you need to follow according to the year. And in this session, I'll try to share that, and I'll take some of the questions. If you have a specific question against a topic, I suggest get those topic-wise questions or
Hello.
or these things, maybe it's separately, but let me start. Right. By the way, I'll go for a hello. Yes, tell me.
So we lost you for the last
Hello.
30 seconds or so. So can you please just...
Yeah, I'm asking you guys which year are you guys in? I just want to know. Sorry.
Second.
Can you know most of you are in which year?
So you can turn off the annotations to your screen.
Sorry?
Sumanto, kindly guide sir with that.
How to turn off that?
Sumanto, can you hear me? Ipshita,
So will you see the options from Zoom, like on the top of your screen? Go to the right hand side and you'll find 3 dots there. Click on that and disable participant annotation.
Okay. I disabled, but still I can see.
You can clear the ones that you have on your screen right now. Go for the annotate option and clear your screen.
Right. Thank you.
Good luck.
Right. Thank you. I can see most of your first years, I mean, most of your second years, third years, and some first years and final years here. Right. Thank you. Right. Before going into anything, how many of you dream? Right. How many of you have this dream? Want to see yourself in Ames? Want to be the Ames topper? How many of you have this dream? Just tell me yes or no. Right. Just tell me yes or no.
All of us would have the same dream, sir. There's no asking you.
Right, but there will be some people, but I want to know how many of you exactly fail, how many of you definitely fail it. Right. I'm glad that most of you are, dreaming very big. That's what, that itself is a success, guys. You are actually dreaming big and you want to achieve that dream, right? So now what you need to do is you need to bring that dream into actions, right? So what you need to do is you need to bring that dream into actions. Now, this dream, whichever you are actually thinking, is actually not going to be just like that one goal or something. It is going to be a journey, complete journey, and it is going to be very, very, very tough journey. You need to be well prepared to achieve that journey and to reach that end goal, right? So for that, what you need to do is you need to identify all the resources. What all resources will help you to reach out to that dream? If you are aiming for Ames top ranker, what all resources you need? Do you need Marrow? Do you need the time? Which professors you need to be in touch with? What textbooks do you need to read? How many number of hours you need to spend per day? You need to find out all these resources. And the next step is you need to, using these resources, create a perfect plan. How do you create a perfect plan? Now make this big dream is, as I said, it is a journey. You need to make small milestones. For example, if you have around 130 days or 100 days or 2 years or left, if you have 2 years left for achieving this dream, in the first year, I'll complete these subjects, these topics, and next year I'll complete these subjects and these topics. In the last 4 months or 5 months, I'll keep it for completely revision. This is how you need to create small milestones. Having a fixed date and complete proper schedule will help you to reach the goal perfectly. There was a saying most of the times, I hope, I don't know whether you listen to Obasali sir or not. He says this quotation, right? If you fail to plan, you are actually planning to fail. Again, I'm repeating. If you fail to plan, you are actually planning to fail. In the similar way, complete plan is definitely needed. Right? You are taking a very tough journey, and if you are not prepared, you end up screwing yourself. Right? So preparation is very much important, and make a perfect plan and have a proper mindset. Now I have a question, right? You might be having a question. How can I maintain a proper mindset, sir? It's very difficult. Many things are actually demotivating us. Now the present COVID situations are not allowing us to go to hospitals. The government is saying that online education or online classes that are done are not valid. How should we be motivated? Make it Make your day like a schedule. Make your day also a very planned day. Imagine if you are sitting at home, it's very, very, very tough to manage your mind. To keep it motivated instead of moving that from different directions. You need to completely focus on one thing, right? How to study. So what you need to do is make a proper schedule of the day. For example, 5 to 7 I'll do exercises or I'll do workouts, and next 7 to 9 I'll actually study, and again 9 to 11 or 9 to 10 I'll complete all my things, and again 10 to 11 or 10 to 3 I'll go with the online classes which are conducted by college. 3 to 5 I'll take a break. 5 to 7 I'll go for jogging or something. 5 to 7, 7 to 8 I'll chit chat with my friends. From 8 I'll study again and sit till 11 o'clock or 9 o'clock. It's 11 o'clock or 12 o'clock. This is how you need to create your plan, your day, and give a fixed timing for your friends. Say that we'll chat. We'll chat ourselves with these timings, right? So don't take me wrong. I'm talking like a friend. That's the reason I'm giving these things. Give a fixed timing for your friends. That will make you and your friends also be comfortable. They'll also talk to you, or they'll also try to talk to you at those timings. In the similar manner for your parents, they'll talk to you. They'll not disturb you when you are studying if you give a proper timing for them, right? So in this way, you can actually manage your complete proper mindset, right? So next, as I said, I asked you to guys find out all the resources, right? And the resources and all the resources you have. What is the best resource you have? What is the best resource? You might be thinking you might be thinking books, you might be thinking the notes you have prepared, you might be thinking many other things. But the best resource we all have is time. Time is the only resource that is best. That is the most crucial resource. And if you are making use of this resource properly, you can actually achieve any dream, right? Make use of this time. If you have 2 years, make a proper plan according to the time. Everything you do should be planned according to the time. So time is the most critical resource, and you should definitely make use of this resource, right? And next, this is one of the most critical thing which all of us miss out, right? That is how we don't have a proper revision plan. We spend up preparing ourselves till the end, but we don't revise. Just tell me how many of you know some concepts, but just because of lack of revision you end up not answering that question, or you know the concept partially, but just because of lack of revision you end up not writing that question properly. I hope this happens with most of you. I'm not saying everyone, but most of you this happens. And in exams, I don't know what happens is the topics which we know will seem, all the questions seems to be like we have known it. But at the end, we will not be able to answer all the questions. That is because of lack of revision. Revision plays a very, very, very crucial role. Whatever you are reading right now, whatever you are doing right now is everything for to have a proper revision. You are listening to the classes which were taught by your professors, and you are actually making notes. Why are you making notes? To actually have a revision before the exams. You are watching Marrow videos, and exactly are you doing? You are writing down your own notes, or you are making use of handwritten notes provided by us, but you will still make the points. That is also for a revision, right? Revision plays a very, very crucial role, and at least you should be able to dedicate 30% of your time for revision, right? So what should you do in the revision? Notes plays a very crucial role, and it should be very, very crisp. Some of you guys make notes in such a way that it will be like a replica of a textbook. It's better to write a textbook instead of notes, right? So if you are making so many pages of notes, so notes should be very, very, very crisp, and you need to write down the points whichever is needed. So what you need to do is, before writing down some points in the notes, ask yourself 3 times why. Why? Should I write down this in this? Yes or no? Why should I write down this? And next, why should I write down right now itself? Right? How much? So ask yourself 3 times while you are writing something in the notes which you are going to revise. And next, for having a proper revision, flashcards and these pearls, whichever we have created, small diagrams will play a very crucial role. So it's always better to make your own flashcards or pearls. Flashcards or pearls means try to put the whole concept in a small chart or a box. That's what I mean by flashcards or box, right? I mean flashcards or pearls. Right, try to keep the whole concept. You try to minimize the complete concept and keep it like a chart or a box. That will help you to revise much more faster. And when you try to shorten the things, you will automatically try to understand the things much more deeper, right? And next, most important point, most of you do this, don't depend on others' notes. It's, I mean, if I need to be blunt, you are actually, I mean, if I need to be blunt, right, you are actually eating something which was vomited by someone. It's so blunt, I'm saying. That's the reason you should not depend on others' notes, right? The things which you like, you write down in your notes. But the notes which was written by someone, they write down the important points which are required for them. They'll not write down the important points which are required for you. The processing, I mean, way you see a topic may not be the same way the others will see the topic. So write down the points, whichever is most important, and don't depend on others' notes. Right? Yeah, I'll go into year-wise strategy. I hope before, I mean, I can give you a beautiful strategy. I can tell you what all topics you need to prepare or anything. But always the most important problem lies in these two. You should have a proper mindset and you should make a proper schedule. If you are not having these two things, it's very hard for anybody to give any strategy, right? Having a proper mindset and having a proper schedule can solve n number of things. In fact, I mean, people like me or many other people is not required if you have both of these things, right? Having a proper mindset and make a proper schedule will solve all the problems whichever you are thinking, right? I hope there are some of the post interns. All the post interns, next exam, NMCBIL has actually passed. Regarding the next exam, rules and regulations will be released within 6 months. But for you, the best attempt is this coming NATE. You have around 120 days left. That means 80 days you can actually keep for preparation, but last 40 days should be completely for revision, right? Try to depend on intern mode, not on revision videos or anything. I know that you are actually late. If you have not yet started, if your preparation is going on properly, that's then pretty cool. If your preparation is not at all, not going on according to your pace, I'll give you a small suggestion. But this strategy, has worked for many number of people, right? So what you need to do is complete most valued subjects. You can see, right? What do I mean by most valued subjects? The subjects which consume less number of hours and can produce more number of marks. What? The subjects which consume less number of hours and can get you more number of marks. How is that? So you can see, this is the schedule, or this is a distribution of marks according to the present need, right? If you can see here, ENT, Ophthalm, Dermat, all these short subjects will give you around 100 questions, 80 questions. There are 8 short subjects. If I consider pediatrics and ophthalmology, you'll have around 100 and 120 questions, right? And you can actually cover each subject within 3 to 4 days with complete videos, right? If you have not covered, or if your preparation is not going properly, the best thing you need to do is complete these short subjects first. all these short subjects should be completely done. You can actually watch, you should definitely watch videos, you should solve QBank modules, everything should be definitely done. This short subject should be completely completed initially, and next to go with OBG, and next to go with patho, and next to go with community medicine. Community medicine will definitely take time, I know that, but there are certain number of concentrate on completely number based questions. You can actually search for number based questions in our Marrow platform in the QBank, right? Complete all those number based questions and complete patho, OBG, and next go for format. And hope you know that if you cover if you cover patho, 40% of your medicine is completely covered, right? So complete these short subjects and next go with OBG, next go with patho, next go with format. These are the definite subjects you should definitely complete. If you complete these subjects, almost 150 marks will be in your hands. 150 marks means almost 50 plus percentage of marks. 150 questions means almost 50% of the questions, right? So complete these short subjects and next to go with OBG and next to go with patho and next to go with this thing, right? Don't think of every video, don't think of watching every video. Complete all these short subjects first, and next from October, actually from this month, your major concentration should go on QBank. Give a grand test right now itself, analyze yourself, right? I'm not covering much on this because there are more number of third years, final years, and yeah, right. Final years, I'm actually feeling pity for you guys. I'm actually seriously because whereas clinical plays a very important role, and you're not having clinical postings, that actually is making me feel little bit bad or feel little bit sad, right? So but the one thing best part for you guys is you have time to prepare well for your prof exams. Prof exams are very important for you guys, because I don't know for you the pattern, how the pattern is going to be, but you will definitely have the NEET PG exam in the next year, right? That is so definite. So make use of that NEET PG exam, and the student, ask your present interns or post interns, what are the most important or difficult subjects that they are actually, they are actually facing to complete the preparation for NEET PG. Almost all the people will say medicine, surgery, OBG, right? So what are the subjects you are studying right now? The same subjects, right? So, and you might be thinking that there will be a different preparation strategy for both NEET, for both PG entrance and prof exams. There is no need of separate preparation for your prof exams and PG entrance. The only difference is in your prof exams, most of the questions will be of clinical. They'll ask some clinical questions. Here the questions will be direct questions, and it is an MCQ based pattern, whereas your prof exams will be theoretical based. That is the only difference, but the complete concept remains the same, right? I hope Ranjan sir has said very clearly, right? Formats may change. We might be playing IPL, we might be playing different things, but the cricket is always a cricket, right? In the similar way, the exam, the subjects remain the same. The only way of dealing, the way of questioning will be changing. That's it, right? So concentrate on that. Your major focus should go on preparation of medicine, surgery, and in medicine, when you are preparing, go with system wise. That will give you beautiful sense of all the all the subjects and all the concepts, right? If you want, I'm ready to share ready to share a document which is more important. I can list out all the important topics that are required for your prof exams, and I can share a document with you. You can ask, I'll share it with the SAMSACON team that can help out, right? That thing I can definitely do it for all the final years, right? I don't want to bring in this thing here itself, right? So the
you can share the document, we'll share it with the delegate groups on WhatsApp.
Yes, okay. I'll share the document. that can help for all the final years, most important topics for your prof exams that I'll try to share, right? And next, I hope I you can understand, right? All the final years, the most important thing you need to do is don't depend on any other things. Depend only on medicine, surgery, and all the final year subjects. Complete concentration should go only on final year subjects. If your basics are not clear, also give your complete 100% in the final years subjects. I know it is going to take a huge amount of time. For all the final years, I'm going to give you one best tip. So the one best tip is, I mean if there are any toppers or any other things, don't take me wrong, uh, so we are human beings, right? We cannot remember everything, and it's very hard to read Harrison textbook, and we try to choose different textbooks, right? We try to choose Davidson or some other textbook instead of Harrison, and we miss out different important points, right? So what can we do is first to watch Marrow video and then try to read the textbook, right? I know most of the toppers and most of the professors will say ulta. Most of the professors or most of the toppers will say ulta. They will say you first read the textbook and then go for the videos. But I am actually saying again and again, first go for the videos and then read the textbook. You'll see the fun in reading textbook. I'm not saying fun in watching the videos. You'll see the fun in reading textbooks. I'll give you a simple example. If I'm giving you Harry Potter books and if I'm giving you Harry Potter movies, which one will we choose? We of course choose Harry Potter movies, right? Because it has audio, it has video, it has created a complete story, and it has tried to give the most important points that are definitely needed. In the similar way, Marrow videos, or I'm saying, right, these videos, first you watch, what happens is first you will understand the basic concept. Once you understand the basic concept, and now if you are reading the textbook, you are actually touching the points which are not discussed, and the dots which are not connected also you will be able to understand. And the English whichever is used in the textbook also will be very familiar and very fun to read the textbook. And videos are easy to revise, and you'll understand the concept much more faster, right? If you understand the concept, then you need not read the textbook. If you're not understanding the concept, then you need to take time and definitely read the textbook. I'm not saying that you should completely dependent on videos only. You can actually watch, you can actually read the textbooks also, and definitely standard textbooks only I want you to read. Sorry, you should definitely read standard textbooks only, right? Hope you got me. So this is the best thing you can definitely do, and this will help you a lot. Without your notice, it will help you a lot. First watch Marrow videos and then try to read the textbook. You'll understand the concepts much more faster. While reading the textbook, you'll see the fun in reading textbook. Right. So next comes the final year. Pre-final years, right? Pre-final year, guys. I hope I cannot see any fun right now because you are not having any clinical postings right now. You are not going on the fields. You first time having community medicine postings, and first time you should actually understand how history and observations are taken. HO is very important, but you are not unable to take it right now because of COVID. I understand the pain, and you are not having fun because you are watching the complete live classes at home, and the year which you need to enjoy a lot, you are unable to enjoy, right? But you might be the first batch to have next exam, right? But no, I'm again saying I'm not giving I'm not giving any comments on that NMC bill, because it was clearly stated that bill has passed. That is so definite. You all know that, right? But all the rules and regulations will be released in, after 6 months. Like competitive reform, after 6 months, you will get the rules and regulations. So first stop worrying about the next exam and concentrate on your things. Again and again, I'm saying, stop worrying about next exam. It's nothing, no need to fear. Actually, it's like it is going, I mean, I am feeling like in such a way that the practical exams which were previously there is actually going to be combined with practical plus theory in one exam. That is going to be a beautiful thing. All the final years know how much difficult it is for practical exams. They depend on number of professors, I'm not saying, right? And we need to depend on n number of professors and all these things. Now, next exam is going to be a combination of it. One thing that is very, very clear is next exam is going to be completely based on clinical approach, right? So for that, what you need to do? Up to now, you don't have a clinical approach. What is the best thing you need to do in the present situation? Start watching medicine and surgery videos. I know that most of the colleges have started teaching final year subjects, but now you need to completely dedicate at least 3 hours in a day for medicine and surgery videos, right? I know that, I mean, you can actually complete ENT and Ophthal much faster. ENT and Ophthal, you can actually complete faster. PSM will definitely take time, right? For completing PSM also, I'll share you some important topics. I mean, some important topics like different programs announced by Indian government. There will be some questions on data. There will be some questions on biostats, right? So I'll share you some important topics. If you prepare that, that will definitely allow you to pass. I'm not saying that these topics will definitely allow you to get honors, but definitely if you read those topics, that will definitely allow you to get minimum prof exam. I mean, minimum pass marks, definite pass marks, right? So I'll share those important topics, but the only one major important thing for all the students here is stop fearing for next exam and start concentrating on medicine surgery videos. There is so much hype, there is so much fear that has been created by different people. I'm not saying the names, but different people have tried to create you huge amount of fear. One thing you need to be pretty sure is ask your final year students, right? They have that experience of prof exams. They take so much of pressure for prof exams. Now if you concentrate right now and imagine that you are going to write your prof exams in the final year perfectly, that is going to get you both PGC license and fourth year is completed. Fourth year is completed, you are going to get a beautiful PG seat and you are going to get a license. That's the most crucial part. So anyway, final year prof exams, it is going to be replaced with this exam, right? So you are going to prepare only once, and you have that complete time right now. Second year, third year, and final year. Almost 2 years is there. 2 years is there, right? Complete concentration should go on medicine, surgery, and all the final year subjects. ENT and Ophthal, you can actually complete much more faster, right? Give your complete concentration on medicine, surgery, and all the final year subjects. This is the best thing you need to do. Don't get tense. Nothing to worry. The prof exams are going to be replaced with the next exam. That's the only thing. Your prof exams, but I understand that this is going to decide your complete future. So you need to be extra careful. That's it. You start giving your 100% right from today itself for your next exam. What is the most important thing you need to do? The most important thing you need to take away from this thing is my concentration from now onwards should be on final year subjects. This is the most important takeaway for all the third years and second years here. Second years, I'll come, right? So all the third years, I hope you got my point, right? So what you need to do is, if you are in third year, try to attend n number of quizzes or n number of fests. What happens is in these quizzes and these college fests, they conduct these different quizzes. Automatically, without your notice, you will try to revise all the first year and second year and basics. Yes or no? I don't know. I mean, Anirudh might be the best guy. And if Anirudh is conducting the SAMSACON, that means he must have attended n number of conferences or n number of quizzes. He will definitely know that if I'm attending a quiz or if I'm attending a fest, I'm trying to learn different subjects all at once.
Yes, sir, sure, sir. We also have different quizzes lined up for SAMSACON as well. We have pre-clinical quiz, a paraclinical quiz, and a clinical medic quiz lined up for the participants. So I guess that will be helpful for them too.
Right. So, I mean, what happens is in these quizzes, without your notice, you will try to cover up different subjects, right? So that's the reason I'm saying all the pre-final years, all the third years, try to participate in different quizzes. Don't worry whether you'll win or don't not win. Concentrate. I mean, if you keep on participating in different quizzes, automatically, at least, what is the worst thing that can happen? You learn up some topics, right? What is the worst thing that can happen? You learn up some topics. You lose some amount of money like 250 rupees or 100 rupees or 10 rupees. But you are gaining some topics. So try to participate in different quizzes. It seems to be silly, it seems to be funny, but that will definitely help. And most important thing, if you are in third year, try to make your own clinical cases. Try to design a clinical case by yourself. I don't know how many of you know here. Marrow is actually a child company of Daily Rounds. Daily Rounds, I hope all of you know, Daily Rounds is also an app where we try to put more number of clinical cases. And it's like a Facebook of all the doctors where we share only clinical cases. And it is a completely free app right now, and you can make use of it. Read the topics in Marrow and try to understand. Try to get some clinical cases from Daily Rounds app. This is a perfect combination, right? And have a strategy. One thing, definite takeaway from this session for all the pre-final years is complete concentration should go on the final year subjects. Nothing to worry about next exam. Only thing you need to depend or you need to think of is how can I make sure that I'm good at final year subjects. Cool. Right. Next, for all the second years and first years, please understand the whole future of your career in the doctor is completely dependent on these first year and second year subjects. Complete future is the foundation of this doctor course. Complete MBBS is doctor profession is dependent on this first year and second year subjects, right? Everything is very important here, and all these first year and second year subjects are very crucial, right? So if you are in second year and if you are in first year, what you need to do? Maybe third years will have different different approaches or different, have much more time, have less time. They might be undertaking the experiment of next, but you are going to be the definite givers of next, right? So what is the most important for you in second year? If you are in second year, concentrate completely on second year subjects until you complete your second year. Don't need to think of any other things. Give your complete concentration on second year. Once you immediately enter into third year, start concentrating again on medicine and surgery. From the first day of your third year, when you enter into third year, I think most of you will enter into third year in the month of February after the exams, right? Or yeah, or some of you might be having exams right now. I'm not pretty sure. If you are going to have exams in the February and if you are going to enter into third year, immediately once you enter into third year, give more importance for your final year subjects. Third year subjects, prepare for prof exams. In third year, once you enter into third year, give your complete concentration on medicine and surgery. Second years, I know that it is very hard to revise these textbooks, right? I don't know how you are able to cope up. I have given a beautiful tip for the final years. You can use the same tip. That is, first watch Marrow videos and then go for the textbook. I hope, I hope all of you are reading the textbook itself, right? I hope, if I take Pato, there is no other textbook other than Robbins. You should completely depend on Robbins. And Robbins itself have around 5,000 to 6,000, 5,000 pages. If I take to and fro, right? It's very hard to complete 5,000 page textbook within 3 months or 4 months. That's where Marrow videos will help you out. First, watch videos and then go and read a topic in the textbook. You'll understand pretty fun. Reading of the textbooks will be fun, right? So in second year, don't think of anything else. For second year also, for second years also, I have created a topic. Important topics that are required for your of exams. I can share with Vijay, and he'll share with you guys, uh, right? And first years, I'm sorry, I have not yet created that important important topics, but I'll definitely try to share in the future, right? So second years, give your complete concentration on second year subjects and second year topics. You need to know that most of the topics are integrated. I'll show you how much integrated the topics are, right? So, and the next thing you need to do is all the first years, complete concentration on first year subjects. Second years, the whole concentration should be going on second year subjects only. Again, I'm saying, until you complete your second year, your complete major focus should be on second year subjects. If you are not understanding the importance of second year, go and ask your final years. Final years will definitely help you out. Definitely tell you how much importance it is. If you, I don't know how can I share. Let me share. 1 minute, guys.
Can we help you with something, sir?
No. I'm trying to take one syllabus document. I forgot to keep it on. Yeah. Right. 1 minute. Stop sharing. So, most of the second years might be thinking, right? If I take general medicine, if I take heart failure itself, it is completely integrated with patho and physio. Not only heart failure topic, right? If I take many, all these, most of the topics are completely integrated with your second year subjects. This is what I am trying to tell you guys. That's the reason if you are in second year, give your complete concentration on second year subjects. Complete your second year. Once you enter into third year, start. No need to think of, don't think that sir, I have not completed first year and second year properly, my revision was not done properly, my basics are not clear. So don't think of anything else. Start concentrating on medicine and surgery. Try to watch medicine surgery videos. Automatically you will be very clear with your first year and second year subjects also, because most of them, these are the complete topics you have in your MBBS, right? And if you see here, the complete vertical, the integration, which topic has actually come in with subject, right? So second years, this is one of the most important takeaway for you guys is second year subjects are very, very crucial. Give your complete 100% on second year subjects. That will allow you to do beautiful in the future, right? All the first years and second years, same thing. Give your complete 100% on the present year subjects, right? So up to now, I'm talking about vertical integration. Vertical integration. What is this vertical integration? Integration, right? For example, this is one of the question that has appeared in NEET 2020, and this question has actually come. Directly repeat from our this thing, right? Imagine if you have watched cerebral gyri video, you will be able to answer that question. If you have watched physiology of speech, you will be able to answer that question. If you have watched types of aphasia in medicine, you will be able to answer that question. Right? That means you have watched videos. If you have watched videos and at least any one of these videos, you have a chance to answer that question properly. In the similar way, if you solve our Q bank in anatomy Q bank, the same question, similar question has come. In physiology, the same question has come. In the medicine, the same question has come, but in a different manner, right? The same thing again comes in the pearls you read here. So what I'm trying to say is, since most of the topics are integrated to each other, one topic is coming in different subjects, and if you use Marrow, automatically without your notice, you are having 4 times revision. How? First you are watching a medicine, first you are watching videos, and next you are solving QBank, and next you are solving tests, and next you are seeing pearls. First revision, second revision, third revision, fourth revision. Automatically without your notice, you are reading the same topic in different subjects and different number of times, which is making your retention power very high, right? So this is the, I hope you know the answer is fluent, right? So again, my question is, I hope most of you know, I can sense that more. Vijay has shared me some of the questions which were most asked by the people, and most of the questions are regarding the next. So you have waited until now, right? Just wait for 6 to 8 months. Let the rules and regulations come, and then we'll definitely give a complete plan, right? So I'll take Q&A right now.
So there are some questions in the chat box. You can take them one by one.
Yes. Can you please Hi. Can you please explain next pattern? I don't have a complete pattern. That's the reason again I'm saying wait for 6 more months or 8 months. The complete set of rules and regulations will be coming out. But if you want, I'm ready to share the proposed model which was created by MA students, right? So this is the document which was shared. This is not the final notification at all. Again, but this was a proposed model, right? So it will be a 3-day exam. It will be consisting of first day it will be medicine and the aligned subjects like pediatrics, dermatology, psychiatry. All the medicine and aligned subjects will be there on the first day. Will be there on the first, aligned subjects means on the first half, it will be medicine and aligned subjects. Aligned subjects means derma and psychiatry, right? So it will be a 3-hour exam and it will be before lunch. And after that, it will be a 60 questions exam post lunch. That will be of pediatrics, right? And next day, it will be of surgery and aligned subjects. And aligned subjects means ortho, radio, and anesthesia, right? So these are the aligned subjects. So all these 4 subjects will be for 3 hours before the lunch, and after the lunch, it will be on ENT, right? And on the third day, it will be OBG and aligned subjects, OBG and aligned subjects. I think there is no aligned subjects, yeah, right? So that will be in the last day, uh, right? And it is going to be a complete 3-day exam, both morning and afternoon. And if you see, most of your prof exams also will be conducted in the similar way, right? You need not worry anything about next exam. It is definitely completely going to be a replacement of your prof exams. So what you need to do is, all the third year, second years, anybody who are fearing of next exam, the only thing you need to concentrate is, am I very clear with final year subjects? So for everybody, final year subjects plays a very crucial role. So make sure that your concepts are very clear. Right. So, I mean, you might be asking, right? So, yeah. So first, next exam one will be licensing and competitive exam. It will allow you to get license, and at the same time you get your PGC through it. Right. Next two will be, I mean, will be completely licensing exam. Whoever have qualified in this will need to give one MCQ based test, which will allow them to get complete license to practice, right? So this is the proposed model, and this is not the complete model. But anyway, just wait for 6 more months or 8 more months. You will get the complete set of rules and regulations. I'll definitely immediately once the rules and regulations are created, I'll definitely take one session after that. Right, let me take the questions. How to effectively take down notes from Marrow? My amount of notes is more. I don't know how to crisp it for revision. That is a very, very, very important, I mean, very nice question. So one thing, that's the reason I said you, right? Ask 3 times why. Once you are penning down something, ask yourself 3 times why. Should I write down this? Why should I write down this? Can't I remember this? Should I write down? Next why? And next why? Is this topic so important? Can't I remember this topic? And that's how you can make yourself which topic you can't remember and which topic you can remember. That 3 times why should I write this, why should I write this, why should I write this, will give you the answers, and that will definitely make you the notes crisp. And second thing I said, right? So if you want to make a notes, if you want to make something crisp, you need to, the best thing is very simple logic, right? A picture or a video can talk 1,000 words. A picture can talk 1,000 words at once. In the similar manner, you try to create a diagram or something which can explain the whole concept. Once you try to put down all those things in a small chart or a flashcard or a diagram, it speaks 1,000 words and 1,000 sentences which you want to write down in your notes. Now you will automatically crisp it. That's where the flashcards and that's where the pearls. If you don't know how to make these flashcards or small pictures which can explain the whole concept, there are pearls in Marrow. I don't know how many of you observe that. Those are called, I mean, they are called pearls because of that reason, right? They're very, very important, and we crisped the complete concept in a small chat, right? Try to watch those pearls. That will give you a sense how to make a complete concept into a small chart or a diagram. You got it, right? And
We
this
have
is
a query regarding pearls too. Uh, Ryan says, how do we efficiently utilize pearls?
so. I mean, the best way to utilize the pearls is whenever you are. I mean, in pearls also, every pearl is divided according to the subject wise and topic wise. You can choose the pearls topic wise and subject wise, right? Now, write down the just pearl number. You can write down. There is a pearl number in Marrow. You can just write down those pearls number. And these pearls number, when I mean, you can put down that in a one paper or one part of notes, dedicate one part of notes only to write down the MCQ idea or pearl number. That will give you a beautiful sense. It can be easily revised, right? I hope I answered that question. Right. So what is the, where is another question? Sir, can you enlist source to practice clinical case based MCQs for next exam? As of now, nobody have an idea. So I cannot say how the MCQs are I mean, anything can be. But I mean, as I said, right, maybe batsmen might be playing different formats, but everybody is playing only cricket. Either it is IPL or any game, right? Either it is IPL or test or this thing. The only thing that changes is the different pattern, but the basic fundamental of cricket will be cricket, right? So if it is an MCQ based exam, your sharpness should be very, very high. If it is a theoretical exam, you have time to recall the things and write down, put down the things. If it is going to be a combination of that, so you need to be, you need to know both, you need to know, have both sense. But imagine if you are preparing for 2020 and test, you are going to be mastering 50-50 also, right? In the similar manner, try to make yourself prepared for both the exams, right? That will give you huge edge. I'll share the document definitely. Same for Robin's too. Yes. What's the name of the app? Please specify again. Daily Rounds. DAILYROUNDS. Daily Rounds. Give me LGS. Definitely, I'll share. I cannot give you questions. Sorry. I can give you important topics. Sorry, I cannot give you questions. I can give you important topics. Right. PSM topics. Yes, I understand. PSM is the most critical. Is the most difficult subject. I can say reading Park's textbook. I know the difficulty. I'm in second year now. When am I supposed to revise the first year subjects? If you are in second year, don't think of first year subjects right now. Completing second year subjects itself is a huge task. You're not understanding that, right? Completely dedicate your time for second year subjects. That will solve a number of problems. Please be thorough with your second year subjects. Give your complete concentration on second year subjects. If your concentration on second year subjects is high, if your basics in second year are high, you will do pretty well in the final year. Revision strategies for third year. Third year, ENT and Ophthal you can complete very fast, dude. The only thing that will worry you is PSM. So maybe for me, but I will be completed much faster and much easier. Only subject that can definitely trouble you is PSM. That you will definitely pass, but yes. Is it important to read Robbins in second year? If you ask me, definitely yes. Definitely reading Robbins textbook is very important. It is so important, like for all the third years, reading Park's textbook is so important. At the same time, for second years, reading Robbins textbook is so important. These are the definite two subjects which I definitely recommend to read the textbooks. PSM, you should definitely refer Park's textbook, and Patho, you should definitely definitely revise through Robbins textbook. I'm sure a lot of students who cannot read the standard textbooks fully can use some other short book with Marrow. Some other short book, no, dude. Always remember, right? Always remember, one thing I want to say is, our profession is the only profession where we cannot test on somebody and give it treatment. First, we should be completely clear. And if this is going to give definite results, and then only we need to prescribe that medicine. We cannot test test a medicine or test somebody for a week or 2 weeks, and then we cannot prescribe. And that's the reason we always prefer, most of the anyone prefer standard textbook for this reason. Yes, if you can read different textbooks, but always remember, right, after some days, even if you become a doctor, then you will, at that point of time also, you'll definitely revise standard textbooks. Instead of revising that at that point of time, make your basics stronger here. That will help you much more faster. Sir, what book would you suggest for pharmacology? I think if I go on telling the textbook names, I need to tell each and every textbook name. I'll try to share the list of standard textbook also, but this takes me 1 or 2 days. So give me 2 days time. After that, I'll try to share. Right? How should we plan our third year? In how much time should we complete third year subjects to begin reading the final year subjects? You need to dedicate 5 hours. In that 5 hours, dedicate 3 hours for the final year subjects, 2 hours for your third year subjects. Very simple. Or else you can do this thing. Morning, you read your third year subjects. In the night before sleep, you read your final year subjects. Very clear. Sir, what books? I again said, right? I'll share the standard textbook list. Whether I should complete with the foreign graduates and other doctors in the next exam for license and degree. I hope this question, whether I should complete with the foreign graduates and other doctors in the next exam. This might be a question from FMG student, I'm thinking, right? When next exam comes up, next exam is the same exam for all FMG students and normal MBBS students. So I don't think you need to give a new exam. When should I revise first and second year subjects if I'm in third year? The best thing you need to do is don't think of first year and second year subjects right now. Automatically, when you are reading final year subjects, you'll learn first year and second year subjects. Imagine if you are reading surgery, if you are reading orthopedics, automatically you will learn anatomy. I'm serious. If you need to, simple, right? Imagine if you are any doctor, right? If someone comes with an bone fracture, you definitely need to understand the anatomy of that part. If you're not understanding the anatomy of that part, you cannot do any surgery. So no need to worry about your first year and second year subjects. Give your complete concentration for your final year subjects, because imagine if you are reading for the final year subjects, you are putting your leg one front. I mean, you are having forward step than backward step. Simple, right? You are going to enter into the future. So let's prepare for the future. Why need to think of the past, which we have not, which we are not clear, right? Give your complete concentration on medicine and surgery. While reading surgery, you will automatically go and read anatomy, right? So that's the reason Marrow, we tend to give all the 19 subjects in our plan because of this reason. Right. So once you are watching surgery and medicine videos, the topic which you think definitely you need to revise, the pharmacology part or anatomy part, you can go and revise with those videos. So, but if you are in third year, give your complete concentration on final year subjects. So, considering the fact that many of us could not study or revise properly in the 6 months, and there were no exams as such, how can we effectively assess our progress? Very simple, dude. There are subject-wise tests. There are subject-wise tests in Marrow. Immediately before starting your preparation, give one subject-wise test of each subject. Understand which topics you are strong in, understand which topics you are weak in. It will tell you how many number of questions you answered according to the topics also. So give a subject-wise test right now and start your preparation for 10 days or 20 days. And then again give a subject-wise test. You have, I don't know how many of you know Marrow here. There is a option called custom module where you can create your own exam with the set of subjects and with the set of topics, right? Make use of that custom module feature and create a test, analyze yourself, and then go ahead. Yes, of course, I understand there is no theoretical based platform where you can assess yourself, but MCQs are the best thing because theoretical exams you can actually sit and write. But for answering these MCQs, your concept should be on your tongue tips, right? You should be able to answer the things within 30 seconds. That's where you can analyze yourself much more better. Is it possible to complete third year subjects in a month or two and then start with the final year subjects being in the third year right now? Definitely, of course. If you ask a final year student, they actually complete TNT and OPTHAL within 15 to 20 days only. I mean, for exams, for a subject like Patho, I know most of them will do one day batting only. They just prepare one day before. If you have 1 to 2 months of time, right? So you can definitely complete. When should we join Marrow? Second year or third year? This question is to be, normally I should not say, but you tell me, guys, if something is definitely going to give you results in the future, will you invest in that or not? Definitely we should invest, whichever time, as early as possible, right? In the similar manner, if you are going to learn some topics, if Marrow is going to definitely help you to understand or learn the concepts, Why are you wasting your time? Imagine you are in second year right now, and you are preparing using Robin's textbook. Instead, you learn. I mean, you have gone through at least once all the topics you have of one subject. I've gone through all the topics at least once. I'm damn sure while writing the exam, you will attempt some questions which you don't know at all. Also, just because of having glance of all the topics at once. Once you had a glance of all the topics, now you will definitely answer those questions, right? It is
Yes.
helping you in revision. It is definitely helping you in revision. So if it is going to help you in revision and reduce your time of preparation, I think it don't waste one. I mean, if one day, I mean, if I take Marrow plan, 46,000 something is for 2 years. That means you are going to spend around 60 rupees to 70 rupees per day. And if this 60 rupees per day I'm going to spend is going to fetch me 5 marks or 10 marks extra, I think that is much more value than spending one more year or I mean, I think that is much more value than spending one more year or losing 5 marks or something.
Or the same, those who still don't have a Marrow plan or are thinking about considering Marrow as a preparation mode. Marrow, being title sponsors for SAMSACON, will be releasing a special pricing plan for all the SAMSACON delegates, which we'll be releasing in the delegate group shortly. So you can go through them and enroll yourself uh, as a Marrow user regarding the same.
Okay.
Any more questions?
Yeah, there is a last question. We haven't had our first prof exams yet. What should we do right now? And when should we join Marrow? When should we join Marrow? Have already answered. We haven't had our first prof exams yet. What should we do right now? The best thing you need to do is first year profs completely revise again first year subjects only. Maybe you don't know the importance of first year subjects, but I know the complete importance of first year subjects, right? So completely concentrate on first year subjects. Don't think of anything else. Complete concentration on first year subjects. I'll share the list of topics. PSM.
Any more questions from any more participants? You can raise your hands or unmute yourself and ask. Giving you 2 minutes to do the same. Any more questions or queries? You can ask sir directly, unmute yourself or raise your hand. This guy really wants some PSM topics, sir. So please do share them with us.
Yeah,
Later
definitely.
on. Also, if you haven't yet registered as a SAMSACON delegate, do so now. We have an amazing lineup of events for the delegates. Namely, we have 4 kinds of quizzes there: preclinical quiz, paraclinical quiz, a clinical quiz, and med algorithm. Apart from that, we have events like crime scene investigation and escape rooms. And with that, we have some amazing keynote speeches lined up for you for the 3 days. That's from the 9th to the 11th of October. Apart from that, just now, as I said, that Marrow, being our title sponsors, have devised a special pricing plan for Marrow for the SAMSACON delegate specifically. So if you want to use Marrow as a mode for preparation for NEET, you can surely avail the discount as a SAMSACON delegate. Any more queries? How to join SAMSACON? How to join SAMSACON? We'll be sharing a group link in the group from where you have received the link for the meeting. So please go through that link and register for free as a SAMSACON delegate.
Okay. I mean, I think there are no more questions. I'll take a leave.
Thank you so much, sir. It was a great session with you. And many of the doubts have been cleared, I guess. For me, most probably, I'm a third year student. and some of the doubts were very, very relevant for me too. We had a great opportunity to interact with you. I guess all the participants would be happy for the same. So thank you so much. Looking forward to the collaboration with Marrow or SAMSACON 2020. Thank you so much, sir.
Thank you. Thank you so much.